This video, I am going to discuss about what is a Cushing triad and reflex, its pathophysiology, its causes, its management, and high yield points related to the Cushing triad and clinical vignette and cases. So, the Cushing triad is a classic sign of increased intracranial pressure, and it is an eminent sign of brain herniation. It consists of hypertension, bradycardia, and irregular slow respiration, right? So, so pathophysiology of Cushing triad. So, what is increased intracranial pressure? It will cause brainstem compression, which will lead to the decreased cerebral perfusion and sympathetic activation, which will lead to hypertension. Hypertension cause baroreceptor reflex to activate the vagus nerve activation, and this parasympathetic activation lead to the bradycardia, right? So so cerebral perfusion pressure formula is mean arterial pressure minus intracranial pressure. So if mean arterial pressure is increased, so it means central perfusion pressure will also increase. Okay, so another component of the Cushing triad is brainstem compression. So brainstem compression will lead to the respiratory dysfunction. So that's why, so three things: respiratory problem, hypertension, and bradycardia. This is a Cushing triad. And Cushing reflects basically the response due to the high intracranial pressure. So these are some causes, high yield causes of the Cushing triad. So traumatic brain injury that include epidural hematoma, subdural hematoma, intracranial hemorrhage that include hypertensive hemorrhage emergency and subarachnoid hemorrhage. So brain tumor increase ICP, increase intracranial pressure from mass effect, obstructive hydrocephalus, CSF building up, increase in ICP, large ischemic stroke, mass effect, and cerebral edema. So, hypoxic ischemic brain injury, drowning, and cardiac arrest. That is a super high yield hypoxic ischemic brain injury, drowning, and cardiac arrest. So, these are some brain herniation syndrome that are associated with increase intracranial pressure. So uncal herniation is highly associated with the cranial nerve 3, that is the oculomotor nerve. It will present fixed dilated pupil. Central herniation, that is a basically affect the midbrain and pons, and it will lead to the decerebrate posturing, that is also known as a extensor posturing. So extensor posturing, what happen in extensor posturing? So in extensor posturing, upper limb and lower limb both are in extension position. So tonsillar herniation, cerebral tonsil herniate through the foramen magnum. So it will compress the medulla and it will affect the respiratory and cardiovascular function. So what is the management of this increase intracranial pressure? So management is definitely to decrease this intracranial pressure by head elevation, hyperventilation, and mannitol are needed to prevent the brain stem herniation. So why the lowering the intracranial pressure is important? Because to decrease the risk of the brainstem herniation. So this is some high yield point of Cushing triad is basically the brainstem compression, signs of the impending herniation. So this is a component of the Cushing triad: hypertension, bradycardia, irregular breathing, and all of due to increase intracranial pressure. So it's required emergent management, mannitol, hyperventilation, and decompression. surgery. So it is associated with the brain herniation. So this is a clinical vignette related to the Cushing triad. A 6-year-old boy found unresponsive in swimming pool and resuscitated after CPR. He remained comatose and placed on mechanical ventilation. Over the next 24 hours, he developed progressively worsening bradycardia and hypertension. His respiratory rate on the ventilator is unchanged, but spontaneous breathing effort become irregular. Fundoscopic examination revealed bilateral papillary edema. Which of the following is most likely underlying mechanism responsible for this patient clinical deterioration? First is cerebral venous thrombosis, increase intracranial pressure due to the cerebral edema, pontine hemorrhage, status epilepticus, and spinal cord compression. So, so this is an explanation of this clinical vignette. So it is increased intracranial pressure due to the cerebral edema, because all of these three triad are present in this the subject except the respiratory. Right, the child experience hypoxic ischemic brain injury due to drowning. Neurons are highly susceptible to hypoxia, leading to the widespread neuronal necrosis and breakdown of the blood brain barrier. This result in a cerebral edema which raises the intracranial pressure. Key finding indicating increased ICP are Cushing triad, hypertension, bradycardia, and respiration, that is irregular respiration, and papillary edema due to increased intracranial pressure. The condition is poor prognostic sign and suggests brain herniation.